Ladies and gentlemen, welcome once again to Ibrahim Traoré's era. Today I bring you a story that will shock you. A story that proves once more that Captain Ibrahim Traoré is not just a leader, he is a visionary, who keeps rewriting Africa's future. For decades, Burkina Faso's health system was hanging by a thread. In countless rural communities, a mother had to travel over 50 kilometers just to reach a hospital. Children lost their lives to malaria because treatment arrived too late. Women gave birth inside taxis or on dirt roads, because no medical facility was close enough. Imagine living in a nation where the nearest doctor could be hours away. That was the heartbreaking reality for millions of Burkinabe, living in remote villages. And to make the crisis worse, hundreds of newly trained nurses sat at home unemployed. Yes, you heard me right. Young men and women who had sacrificed years in medical training were told after graduation, "There are no hospitals for you, no clinics, no jobs." A wasted generation of healers, while people were dying daily of treatable illnesses. It was not just tragic, it was criminal. But then Traoré stepped in. Captain Ibrahim Traoré looked at this injustice and declared, "Enough is enough." If villages had no hospitals, then hospitals would go to the villages. If patients could not reach doctors, then doctors and nurses would reach the patients. And with that bold decree, he launched 500 mobile hospital trucks, a historic project that is transforming healthcare not just in Burkina Faso, but across Africa. These are not ordinary trucks. No, my people. These are state-of-the-art mobile clinics on wheels. Each one is fitted with hospital beds, diagnostic machines, refrigerators for vaccines, and life-saving emergency kits. And on board, teams of nurses and medical staff, ready to serve, ready to treat, ready to save lives. The plan is simple but revolutionary. Every community without a hospital will now have at least 2 of these mobile units permanently assigned to them. On top of that, 100 specialized emergency vans will move across the country like guardian angels, responding instantly to urgent calls. Picture this: a child in a faraway village suddenly collapses with severe malaria in the middle of the night. Before, the family would panic, scramble for transport, and maybe, just maybe, reach a clinic after hours of agony. But now, they pick up the phone, dial the local health line, and within minutes, a mobile hospital truck arrives, fully equipped, fully staffed, and ready to save that child. For the first time in Burkina Faso's history, healthcare is moving faster than death itself. Here's the beauty of Traoré's idea. It isn't just about trucks and equipment, it's about people. All those unemployed nurses who once sat at home hopeless, they now have jobs. They now have purpose. They are now soldiers in a new kind of army, the army of life. From the bustling cities to the most remote hamlets, nurses now wear their white uniforms with pride, standing tall inside these mobile clinics and saying to their people, "Your life matters. We are here for you." This is more than healthcare. This is dignity. This is justice. This is leadership that listens and acts. Burkina Faso is proving to Africa and the world that when a government puts its people first, what others call impossible becomes reality. This is not random. This is a carefully designed health revolution. The 500 mobile hospital units are divided into 3 categories. Some are community hospital vans, trucks permanently stationed in rural areas that had no hospitals before. Each community gets 2 vans functioning as 24/7 mini-clinics. They can handle childbirth, malaria treatment, vaccinations, minor surgeries, and chronic conditions like diabetes. Others are emergency patrol units, 100 specialized trucks that move constantly, covering whole regions and responding to urgent cases. Think of them as flying ambulances on wheels. Accidents, outbreaks, snake bites, they are the first responders. Then, specialized medical units. Some vans are equipped with tools for eye care, dental services, maternity emergencies, and large vaccination drives. Imagine a farmer in a forgotten village having his eyesight restored without ever leaving home. And how are they powered? Each truck is fitted with solar panels. In a nation where electricity is scarce in many places, these vans carry their own energy, running day and night, fueled by the Sahel's sun. Traoré also solved another problem. Thousands of nurses who had roamed the streets jobless now stand proudly employed. Over 3,000 young professionals have been absorbed into this initiative. They are not just workers. They are lifesavers, respected by their communities, walking symbols of hope. To coordinate all of this, Traoré ordered the Ministry of Health to establish a mobile hospital command center in Ouagadougou. Using GPS and communication systems, the center tracks every van in real time, monitors patient numbers, and dispatches units to emergencies like a military operation. It is discipline and organization applied to healthcare. And my people, the results are already here. In just weeks of operation, in Burkina province, one mobile hospital has already safely delivered its 100th baby, lives that might otherwise have been lost. The locals now call the van the womb of hope. In the Sahel region, where displaced families once faced deadly outbreaks, mobile hospitals have vaccinated over 25,000 children in record time, stopping cholera and measles in their tracks. Just last month, 14 victims were treated on site. 13 survived, a miracle compared to the tragedies of years past. These are not numbers. These are mothers, fathers, children, alive today because their government chose life over excuses. Everywhere these vans arrive, they are celebrated. Communities welcome them with drumming, singing, and prayers. Elders bless them. Children chase them through the streets. These are not just trucks. They are symbols of a nation reborn. And the world is stunned. How can a small country, under sanctions, under constant attacks, still achieve something this advanced? The answer is simple: leadership that puts people first. This is why Traoré is different. While other leaders waste time at foreign summits, begging for aid, he is building solutions his people can touch and see. While others cry poverty, he is proving innovation. The message is clear: Burkina Faso will not wait for the West to save it. Burkina Faso will save itself. These 500 mobile hospitals are not the end. They are the beginning. Permanent hospitals will follow. Training schools for emergency workers are being built. And as Traoré himself said, a people who can heal themselves are a people who can free themselves. Mark this down. By 2030, the name Burkina Faso will no longer be tied to poverty, but to resilience, resistance, and revolution. And to the rest of Africa, Traoré's message is loud. If Burkina Faso can rise with almost nothing, then what excuse do you have? This is not just healthcare. This is history in motion. This is Ibrahim Traoré's era. Like, share, and subscribe, because the revolution is alive.